This is For the Health of It, a program dedicated to your health and wellness in the 21st century. I'm your host, Burt Williams, and today we welcome to the show David Rawbach, who is with the Oklahoma Proton Center. David, thanks for being with us this morning.
Thanks, Burt. It's a privilege to be on with you today.
So first of all, let's just talk about the Oklahoma Proton Center. Tell me a little bit about that and what you do there.
Sure. So Oklahoma Proton Center is a state-of-the-art cancer treatment facility in Oklahoma City. We've been open since 2009, so we're entering our 12th year of operations here. We offer a treatment called proton therapy, which is a form of radiation treatment for cancer. We use proton therapy to treat a variety of disease sites like lung, breast, head and neck, esophageal, prostate, brain cancer, and many more. Proton therapy is widely considered the most precise form or most advanced form of radiation treatment available today.
Now, you mentioned you've been there for 12 years, you said.
Yes.
I'm guessing, just like any other medical profession, you've seen some amazing advancements over that 12-year period of time, no?
We have. I mean, and obviously we try to keep up with things going on in the world of oncology. Unfortunately, just about everybody's going to be impacted by cancer at some point in their life, whether it's themselves personally or a loved one or a family member. But the fortunate thing is that we've come a long way in our ability to treat cancer and be precise and reduce side effects. I think one of the things that we really try to focus on is not just the cure of the cancer, but the quality of life during and after treatment. There's many cancers today where we have a really high survival rate. Prostate cancer is a great example. Generally speaking, the survival rate for prostate cancer 5 years after diagnosis is going to be above 90%. So then it's really important to think about what's my quality of life going to be? Am I going to have urinary incontinence? Am I going to have sexual dysfunction because of my treatment? And so those are things that we really try to focus on as a facility, not just the cure, but that quality of life afterwards.
So with standard cancer treatments, you've got a few options. There's, of course, chemotherapy, there's radiation, and then there's surgery. Those three things you can do. How does proton therapy fit into that, and does it offer maybe an alternative to any one of those three that someone might want to consider?
Yeah, that's a great question, Bert. So those really are our three tools. It's drugs, it's radiation, or we can go try to cut the tumor out. And oftentimes for patients, it's going to be some combination of all three. Breast cancer is a great example of a cancer that's pretty common that oftentimes requires surgery and then chemo and then radiation. Proton therapy is a form of radiation treatment. And so really where proton therapy could come into play is if a patient is recommended or prescribed radiation as an option for their cancer treatment. And what makes proton therapy unique is that with proton radiation, we're actually able to stop the radiation inside the tumor, whereas with most conventional X-ray radiation treatments, what you're doing is you're shooting that radiation at the tumor, but it doesn't stop. And so you end up exposing healthy tissue, critical organs to unnecessary radiation that could potentially be avoided with proton therapy. So we like to describe protons as almost like a little hand grenade that we're able to precisely drop inside the tumor, and that's where most of the damage is done, which is what you're trying to do, obviously, is damage the cancer cells and the cancer DNA and kill the cancer.
So explain a little bit about that, because it sounds like you've created something called a smart bomb that hopefully will not have nearly as much collateral damage as maybe the old way of doing things in terms of radiation. How do you do that? How is proton therapy able to do that inside the cell without destroying things around it?
Yeah, that's a good question. So radiation has been used to treat cancer for over 100 years. And the goal with radiation has always been, it's actually very simple, that radiation oncologist gets to residency. They say, you're going to learn everything you need to know right here on the first day. And that's more radiation to the tumor, less radiation to healthy tissue. So everything that we do in radiation therapy for cancer is governed by that overarching goal. So with protons, we're literally using proton particles. So you think back to like high school chemistry. You get protons and neutrons and electrons in the atom, and we're able to use electromagnetic waves and radio frequency signals to extract protons from hydrogen atoms. And so then we have a free proton, and we actually accelerate that to 2/3 the speed of light. So 2/3 the speed of light. At that speed, you could circle the Earth in four times in 1 second. So blink your eye, you've gone around the Earth 4 times in 1 second. So that's how fast that proton is traveling. And what we get it charged to that speed, and then we shoot it down a beam line into a treatment room. And the patient is laying there on a table at the end of this beam line. And there's a series of magnets along that proton's journey that are steering and potentially slowing down that proton before it gets to the patient. And we're able to precisely charge or control the speed of that proton. So when it goes into the body, it goes a certain distance and then stops. And so when that proton stops, we can target it so it stops inside the tumor. That's where it's doing that damage to the DNA of the cancer cells. Really, I believe it's the most sophisticated medical treatment available today. I mean, when you see the facility and see the equipment and see the particle accelerator and the superconducting magnets and the software, it's pretty amazing to look at.
Well, and it brings back some discussions I've had in the past with other professionals when they talk about radiation. They're really limited by how much radiation they can give a person because of the fact that it will kill them. So in a lot of instances, they're getting a radiation dose which is almost lethal to try to kill the tumor that's inside their body. What you're saying here is if you take that particle and you're able to aim it only at where it needs to go, then maybe the lethality drops down to near zero, correct?
That's correct. Yeah. I mean, and because of the precision of protons and because you're doing such a good job of sparing healthy tissue and critical organs around the tumor, we are potentially able to what we call dose escalate or deliver more radiation to the tumor than you might otherwise be able to do with other forms of radiation. And this especially becomes important if you're if a cancer recurs in an area that's around where the original tumor was. There's a limit to how much radiation, like you said, that the body can take before it really starts to shut down. And so oftentimes we're able to go in and do things that you couldn't do with conventional X-ray radiation.
So your process certainly is unique compared to the way we've always done it. Are you the only office in Oklahoma that does this, and how many more are there around the states?
That's a great question. So today, actually, let me step back because I think this is kind of interesting. So people like to think of proton therapy as new, and I guess it's new in the sense that there's not that many facilities around. There's 35 in the country. But the first patient was actually treated with proton therapy back in 1954. And the technology for proton therapy, this ability to accelerate and control subatomic particles, was actually developed as part of the Manhattan Project. So the Manhattan Project, we developed nuclear bombs during World War II, but there was actually a lot of other technology and uses for this technology that came out of that project, and proton therapy happened to be one of them. So proton therapy has been around since 1954, but from 1954 to 1990, patients were only treated at research laboratories. There wasn't what you and I would think of as like a clinic-based or a hospital-based proton therapy center. And the first one of those opened at Loma Linda University in California in 1990. So fast forward to 2009, the Proton Center here in Oklahoma City opens Oklahoma Proton Center. At that point in time, it was the 6th Proton Center in the country. So you had the first one in 1990, the 6th one in 2009, but today there's 35 Proton Centers. Some of the other ones in our area would be like MD Anderson down in Houston. There's a facility in Dallas. The University of Oklahoma has a single-room Proton Center. Mayo out in Scottsdale. But there's a lot of areas that still don't have access to Proton. So Tulsa is an example. There's not a Proton center in Tulsa. There's not one open in Kansas. There's not one open in Arkansas. So we actually do get a lot of patients that travel multiple hours to come here to Oklahoma City for treatment.
So how many clients do you see in a year?
So we'll probably treat this year about 500 patients. And like I mentioned, this is across many different disease sites. I think last year we actually treated about 75 or 80 unique individual cancers and about 450 patients last year. And I think we'll probably do about 500 this year.
Is that a situation where, have you maxed out at 500 or could you grow from there in your present facility?
No, we could definitely do more. I think at least a few hundred more before we would start to run up against capacity. And really for us, I mean, because there's not that many facilities around the country, oftentimes our biggest challenge is awareness. People just don't realize that there's other options out there, or even that something like proton therapy is in Oklahoma. You think of that as being something that would be in Boston or Chicago or Houston or Los Angeles, but not here in Oklahoma. So we're really fortunate to have actually not one, but two proton centers here in Oklahoma.
Okay, so we've talked about the difference between just the regular chemotherapy and the difference that the proton therapy offers. Is this a situation where someone might say, or a doctor might say, well, you've got this type of cancer, we're going to start with the traditional treatment, but if we don't see success there, we're going to go to proton therapy? Or would they, instead, should they say, let's just start with proton therapy and go there?
We always, I mean, if it's me or if it's you or it's a family member, I mean, I would want the best right away, right? Okay. I mean, if there's something, and I've never found a point in my life where I thought more radiation was better than less radiation. Maybe I'll wake up one day and decide that, but that's not the case, I think, for most people. And so what we always encourage patients that come to our facility, or this is what I tell a family member, is be your own advocate. Get educated on the options that are out there. Don't necessarily do the first thing that's recommended, even if it's proton therapy. I mean, if somebody comes here, I encourage people to educate themselves, be informed consumers, talk to multiple doctors, get multiple opinions before you do something that's as serious as cancer treatment.
So then,
and it's just so important.
In this case, there's proton therapy is not. Figure out how to ask this question correctly, but it can be the first thing you go to. It's not something that would only be used in unique cancer situations, correct?
No, yeah, exactly. Okay. No, it's absolutely a frontline primary treatment for many cancers: breast cancer, lung cancer, prostate, head and neck, brain, etc.
Okay, so the success rate, can you talk about that a bit?
Yeah, so obviously the primary goal when we treat cancer is to get rid of the cancer. And so we think about, in the field of oncology, we often think about what's called disease-free survival. So that's not just, is the patient alive, but is the patient alive and is the cancer gone? And oftentimes an important benchmark is 5 years post-treatment. So I mentioned prostate cancer is a great example. So for low-risk prostate cancer, the 5-year disease-free survival with protons is going to be 97, 98%. For intermediate risk, it's about 93%. For high risk, it's going to be about 85%. And those are great statistics. Those are great numbers, a very high success rate. For other cancers, it's really just going to vary depending upon the staging for the cancer and the disease site and other considerations like comorbidities.
Okay, so someone comes in and they are going to get the proton therapy treatments. Obviously, under normal circumstances, if they're going the traditional way, the doctors are going to suggest that they go through a period of radiation treatments that are going to last X number of days or a couple of months. How does that compare with proton therapy? How do you do it?
So it's a very similar process. If a patient would be prescribed a certain number of daily treatments of regular radiation, they're probably going to get prescribed the same number of daily treatments with protons. One thing that we have been able to do with certain disease sites or cancers is actually do what we call hypo fractionation, where we're delivering a little bit of a higher dose each day so we get through the treatment quicker. We're able to do that with protons because, again, we're sparing more healthy tissue and critical organs, so you don't have to spread out the radiation over as long of a period of time necessarily. Now, that's not the case for everybody. There's unique circumstances where we're able to do that, but it's something that our facility is really trying to be at the forefront of, because it's more convenient for patients if they're coming to get 5 treatments instead of 20 treatments or 30 treatments. And so we have a number of research protocols open, and we're partnering with top cancer centers like MD Anderson and Mass General Hospital and Mayo Clinic on these research studies to look to see how quickly we can deliver treatment, or can we get it done in fewer days versus a more extended period of time.
So then, as you said, in each situation, it's going to be unique in terms of how long it might take. It is,
yeah. And I would say a good, a kind of an average for radiation across a broad spectrum of disease sites is going to be about 5 to 6 weeks.
Okay.
And that's every day, every business day for 5 to 6 weeks.
Now, does it have an effect on the individual in terms of? I've talked to friends who have had to go through the chemotherapy and the cancer treatments, and they talk about the radiation and how it makes them feel after it's. They have a recovery period after each one of those sessions. How is the proton therapy recovery period after a session for a person?
So honestly, it's pretty amazing to see patients come and get proton therapy and just see how well they're able to recover on a day-to-day basis. I mean, we have people that continue to go to work. They continue to work out. We actually had a head and neck cancer patient, which is a really tough cancer to treat, he was training for a marathon, and he continued with his training even during treatment, which with regular radiation, there would have been a pretty high likelihood that he would have ended up on a feeding tube and suffered pretty significant weight loss. But that didn't happen with proton therapy. So, and that's not to say that patients don't get fatigued going through the process. Of course, it's mentally and physically challenging to have cancer and to go through any type of treatment. But fortunately, we usually see patients do pretty well on a day-to-day basis going through proton therapy.
What about the recovery overall? You've gone through the recommended number of visits, and then in terms of being able to recover from all of that together, how does that compare?
So again, same thing. I mean, your side effects with protons are typically going to be less the weeks and months after treatment, and it just depends on where the cancer is and what you're treating. I mean, a lot of guys that get prostate cancer treatment with radiation, they're gonna heal up from most of their side effects within probably 12 months or so. Proton therapy is not dissimilar. If there are any side effects, they're usually gone in about 12 months or less. But again, there's usually fewer or less severe side effects. If it's something more challenging, like a brain cancer treatment or some type of lung cancer treatment, it might be a little bit more of a challenging or rigorous recovery post-treatment. And what we do as a facility is, for us, the treatment's not done when the treatment's over. We stay with the patients and meet with them 1 month, 3 months, 6 months, 12 months after treatment. Our new nurses do a great job of getting on the phone and talking with those patients and just helping them manage the process. And I'll say this too, Bert, this is incredibly important. It's not just the physical challenge, it's the mental challenge. And for us, mental health during and after treatment is so important. And just finding that community, we really try to facilitate patients finding a community of people that are going through the same thing, because it just really helps with the healing process.
So Stanford did a study on proton therapy. Talk about that for a minute.
Yeah, this is actually a pretty amazing study, and not even something we necessarily expected from Stanford, because they don't have a proton center yet. They've been trying to get one, but it's a little bit complicated to get a project like this going in California. But nonetheless, what they did is they looked at over 500,000 patients, and what they looked at was the incidence rate of second cancer post-treatment. So basically, did the cancer come back after treatment? And maybe even did it come back because there was radiation that caused another cancer, even while treating the original cancer. And what they found was about a 69% reduction in the incidence rate of second cancers with proton therapy versus regular radiation therapy. So basically, across multiple different disease sites, if you got protons or if you got regular radiation, you had a 69% lower chance of having a cancer show back up with protons than with regular radiation.
And how long did they run this study?
Man, that's a good. It was, I guess, the median follow-up time was a little over 5 years. So you were looking at patients pretty good ways post-treatment, over 5 years post-treatment.
Okay, so basically they kind of validated what you guys were doing, it sounds like, and gave you some pretty good numbers to at least show to people in terms of how successful this process can be and how non-invasive, I know that's not the right word, but it's not nearly as destructive on the body as, say, a regular type of radiation might be.
That's correct. And, there's another study out of UPenn that came out around the same time, and what it showed was a 69% reduction in grade 3 or greater. So grade 3 would be considered a severe case or side effect. So grade 3 or greater side effect during or within 90 days post-treatment. So you've got Stanford looking at incidence rate of second cancer. You've got the University of Pennsylvania looking at severe side effects, and both showed almost or over a 2/3 reduction with proton therapy versus regular radiation. And for me, I always look at what's happening at the top cancer centers, right? Like what MD Anderson, Mayo Clinic, Memorial Sloan Kettering, University of Pennsylvania, Stanford. These are the researchers that are going to be at the forefront of any field, and oncology is not an exception. What are they doing, or what are they finding? And these are institutions that really are validating the efficacy of proton therapy.
So as far as the early detection as far as cancers are concerned is really important. You feel like there's something wrong with your body, you need to go to your doctor and find out what's happening. With that in mind, though, is proton therapy something that maybe can be more effective if the cancer is farther along than normal with regular radiation, or no?
Well, I absolutely think you hit the nail on the head that early detection is critical. And certainly there can be things that we can do with proton therapy. We can be creative with the treatment planning and maybe deliver, like we talked about, deliver a little bit more radiation or deliver radiation to a little bit bigger area if we need to. If the cancer spread, then maybe you could with regular radiation. But ultimately, we, meaning oncologists, are going to do a better job treating cancer regardless of the tools at our disposal if we catch it earlier. And that's why it's so important to do mammograms. It's so important to do PSA checks, colonoscopies, lung screenings if you're at high risk for lung cancer. And breast cancer is a great example. If you have dense breast tissue, go and get not just a mammogram, but maybe a 3D mammogram or an ultrasound, because we're going to do a better job detecting breast cancer that maybe wouldn't show up on a standard mammogram. So we really preach that screening is super important at Oklahoma Proton Center.
Let's talk a little bit about insurance in terms of paying for the process. Is there anything that a person should know about proton therapy as far as their insurance is concerned? Do most insurances cover this type of treatment?
So we have contracts with all of the major payers: Blue Cross, Aetna, United, Cigna, all the major commercial payers. They all cover proton therapy. Now, we do have to go through a prior authorization process most of the time. And most of the time we get patients approved if our doctor prescribes proton therapy, but sometimes insurance companies, I'm sure everybody's had to deal with this at some point in their life. They don't always say yes.
Yep, that's true.
But our team will do what we can to try to fight for patients to get them approved if we do get a no. But we get about 70% of cases with commercial insurance approved nonetheless. And then Medicare offers very broad coverage. So if a doctor prescribes proton therapy, one of our doctors prescribes it, Medicare is going to cover it. We never have an issue with getting Medicare to pay for treatment. Okay.
So you're in Oklahoma City and I'm in Tulsa. Maybe I can't drive over there and talk to you guys. But I notice here that you do have telehealth consultations that are available if I want to talk to a doctor. How does that work?
Yeah, that's something that we started up not too long ago. We actually started it up pre-COVID, although with COVID it became even more important to be able to offer a telehealth option. But we just were having so many patients reach out to us from out of town that we really wanted them to be able to get to talk to a doctor as soon as possible. And the best way to do that was, we've got great technology, Zoom or FaceTime, there's 100 different software programs that we can use to connect with that patient face to face and allow them to talk to the doctor. And we're able to do just about everything that you would normally do with a consult, an oncology consult, via that video conference versus the patient coming in and having to drive here. So
you mentioned, obviously, the proton therapy idea has been around since the atomic bomb. But at the same time, you tend to be not well known, and you're working to change that. I go to a doctor, and I'm talking to my doctor about some problems I'm having. It looks like there may be cancer involved, and he doesn't know about you, or he doesn't have any ideas about what you guys do, and he's not willing to suggest that I go to you. What would I do then?
Well, you can reach out to us directly, and the nice thing is that we're able to see patients without having to have a physician referral. So it's as easy as getting on our website and calling the number on our website, or filling out a web form on the website. We've got a team that answers the phone 8 to 5. You talk to a live person, and more often than not, we can get patients in to talk to a doctor either via telehealth consult or in person within a few days. So we make the process very easy, and that's a low commitment. You're just going to talk to the doctor. There's no invasive procedures or anything complicated about it other than you just get to talk to one of our specialists. And what we always tell patients is talk to somebody who specializes in the treatment that you're considering. So, for example, you wouldn't call a plumber if you have an electrical problem, and it doesn't make sense to talk to a doctor who doesn't use proton therapy every day to ask them about how proton therapy would work for them. Talk to a doctor that is trained in proton therapy, specializes in it, uses it on a regular basis. And we would say the same thing, too, for us, for procedures or services that we don't offer. Go talk to a doctor that specializes in it. But like I said, we make it very easy for patients to talk to one of our oncologists if they're interested.
All right, so February is Heart Health Awareness Month, and certainly women with breast cancer might have that on their minds in terms of proton therapy. Can you talk a little bit about heart health in relation to proton therapy and breast cancer?
Yes, yeah. So, man, it's something it's a really big challenge and issue with breast cancer treatment. You've got the cancer there that's right by the chest wall, and oftentimes the heart is right by where the area is that we need to treat. The chemotherapy drugs that we use oftentimes for breast cancer treatment are cardiotoxic, meaning that they can cause heart complications, and then you can compound those problems if you're also delivering radiation that's hitting the heart. And so one of the issues that as a field in oncology that we've really had to deal with is women that got treated for breast cancer 5, even 10 or 15 years ago that are then re-presenting with very severe heart complications. And so with proton therapy, more often than not, we're almost able to or can completely eliminate any radiation hitting the heart during treatment. And this is especially important for women that have cancer on the left side that's even closer to the heart. So we really encourage women that are diagnosed with cancer to not just think about treating the cancer, but think about the health of their heart, because what they're about to go through can do damage to their heart. And so it's really, really important to take care of that critical organ.
All right, so let's end by talking about your website. I'm sure you have one that has a tremendous amount of information. Where is it, and how can we find it?
Yeah, so our website is, we try to make it easy, okcproton.com, so www.okcproton.com. And we really want that website to be a resource for patients that are trying to get information about treatment. So we've got a lot of information on there about proton therapy, but also a lot of information on there just about cancer treatment in general and diagnosis and screening and symptoms of cancer. So it's a great resource for people that have been diagnosed or friends or family members who are trying to do research for a loved one.
David Raubach with the Oklahoma Proton Center in Oklahoma City. You can visit their website at okcproton.com. This has been For the Health of It. I'm Bert Williams.